Hello, today we are going to talk about scoliosis in this video. So let's not wasting the time and start our topic today. Scoliosis defined by the sideways curvature of our backbone. It's always happen during the growth in childhood or adolescence, and the reason of developing is still unknown. There are many external factors my worsening is such as carrying the heavy load or maintaining the bad posture throughout the day. But scoliosis is already exists before all of those factors. It's just unnoticeable. To test out a person whether he or she is suffer from scoliosis, you can ask them to simply bend down and see whether there's uneven level over their back. Many kids with scoliosis have one shoulder blade that's higher than the other or an uneven waist with a tendency to lean to one side. This problem may be noticed when the kid is trying on new clothes. If one pant leg is shorter than the other, a kid might have scoliosis. We can expect scoliosis when we notice some sign or symptom over the body. The first one is uneven shoulder level, which is you will see the one side of shoulder is higher than another side of shoulder, and prominent hip to sides. So which is the hip will shift to lower side of the shoulder, and all of this is caused by the curvature of the spine. So because our spine is a 3D structure, so whenever there's a curvature, there will be a rotations of rib, so causing the rib hump over one side of our body. Lastly, imbalanced musculature, and this is caused by the uneven weight loading on the spine. Professionals such as orthopedic doctor or physiotherapy use Cope angle as a measurement of spine curvature for scoliosis. For Cope angle less than 10 degrees are not considered as scoliosis. Sometimes it is only caused by the back muscle spasm, such as carrying heavy load or bad posture as mentioned before. This might worsen the scoliosis if and only if they have this problem, or else it can be corrected by the general stretching exercise. For Cope angle more than 45 degree to 50 degree, doctor will suggest to go for surgery due to possible complications. If the age is too young for surgery, then bracing is recommended until they are ready for the surgery. There are three treatments available for scoliosis management. If your curve angle is minimal and not more than 45 degrees, then you can go with conservative ways such as physiotherapy. Physiotherapists that using Scrolls method to emphasize on the posture corrections. Doctor or physiotherapist will first assess the risk of progressions of the backbone from the bone maturity and growth rate, and then only determine the needed treatments for the individuals. A six, a six, a 6-month X-ray review is needed to track the latest spine conditions and ensure a proper treatment given. Next is bracing. This is the passive posture corrections that require the individual to actually wear the brace for 23 hours per day, and it is only suggested according to the risk of the progressions of the curve and some other criteria such as the age is too young or the individual is in puberty periods and the curve angle is too large. Last is the surgery management. The surgery named spinal fusions. Its basic idea is to realign and fuse together the curved vertebra so that they heal into a single solid bone. With the tools and technology available today, the scoliosis surgeons are able to improve the curve significantly. Next, this is one of our patient's testimonial. With 1 month of growth therapy undergoing, he has better posture with good hand-hip distance and reduced hump prominent over his back and improved his spine alignment as well. Thank you for watching our videos.